Avant de commencer la leçon d'aujourd'hui, on va faire un petit récapitulatif des noms de chaque système du corps humain appris au cours de notre dernière leçon. Essayez de répéter après moi la prononciation de chaque système et n'hésitez pas à arrêter la vidéo si je vais trop rapidement pour vous. Alors commençons avec le système digestif, dit the digestive system. The digestive system. Pour le système endocrinien, on dit the endocrine system. The endocrine system. Next, we have the integumentary system. The integumentary system. Pour le système cardiovasculaire, on peut dire soit the cardiovascular system, or the circulatory system. The circulatory system. Pour le système reproductif, on dit the reproductive system. The reproductive system. Et pour le système urinaire, the urinary system. Urinary system. Next, we have the nervous system. Nervous system. Next, the musculoskeletal system. The musculoskeletal system. Pour le système respiratoire, on dit the respiratory system. The respiratory system. Et enfin, pour le système immunitaire, the immune system. Immune system. Now, let's start with the subject of today's lesson, which is symptoms and diseases. First, symptoms are any feelings of illness or discomfort which can be caused by a health problem, qui désigne tout sentiment de maladie ou d'inconfort causé par un problème de santé. Example, if a patient has the flu, his symptoms would be a fever, une fièvre, a runny nose, un nez qui coule, and a cough, une toux. So, when asking for symptoms, a doctor might ask, what's wrong? What's wrong? Qu'est-ce qui ne va pas? What's the problem? What's the problem? Quel est le problème? A more specialized question is, what are your symptoms? Quels sont vos symptômes? When did the symptoms start? Quand est-ce que les symptômes ont-ils commencé? And to report a patient's symptoms or a complaint, a doctor says, the patient was admitted complaining of. Essayez de répéter. The patient was admitted complaining of. Le patient a été admis se plaignant de. Next, we have diagnosis. A diagnosis is the identification of the nature and cause of a certain phenomenon. C'est l'identification de la nature et de la cause d'un certain phénomène. In other terms, is the medical name that encapsulates all the symptoms of a condition. Ça encapsule tous les symptômes d'une condition. For example, when a patient says he has these symptoms, I have a fever, a runny nose, and I've been sneezing. The doctor might say, my diagnosis is that you have the flu. Essayez de répéter après moi. My diagnosis is that you have the flu. Mon diagnostic est que vous avez de la grippe. Pain. Pain is a feeling in your body when you have been hurt or when you're sick. C'est un sentiment quand vous avez été blessé ou quand vous êtes malade. Suddenly, she felt a sharp pain in her neck. Sharp pain means une douleur vive. So, suddenly, she felt a sharp pain in her shoulder. Soudainement, elle a ressenti une douleur vive au cou. Take an aspirin to relieve the pain. Prends de l'aspirine pour soulager la douleur. Next, we have ache, which is a continuous pain. une douleur continue. I can't sleep because my head aches too bad. Je ne peux pas dormir car j'ai trop mal à la tête. I have a terrible headache or backache or stomachache. J'ai terriblement mal à la tête, au ventre, au dos. Ill is suffering from an illness or a disease, not feeling well, souffrant d'une maladie, ne pas se sentir bien. My elder sister is seriously ill in St. John's Hospital. Ma sœur aînée est gravement malade à l'hôpital de St. John. The children started to feel ill an hour after the meal. Les enfants ont commencé à se sentir mal 1 heure après le repas. Next, we have sore. Sore is painful and often red because of an infection or because a muscle has been used too much. Douloureux et souvent rouge à cause d'une infection ou parce qu'un muscle a été trop sollicité. She says her stomach is still sore after the operation. Elle dit que son estomac est toujours douloureux après l'opération. His feet were sore after the bicycle trip. Ses pieds étaient douloureux après le voyage à vélo. We have disease. Any harmful deviation from the normal functional state of an organism, tout écart préjudiciaire par rapport à l'état fonctionnel d'un organisme. Generally associated with certain signs and symptoms. Généralement associé à certains signes et symptômes. Peter's uncle suffers from a rare blood disease. L'oncle de Peter souffre d'une maladie rare du sang. A fatty diet increases the risk of heart disease. Une alimentation grasse augmente le risque d'une maladie cardiaque. The government is planning further health measures to prevent the spread of disease. Le gouvernement prévoit de nouvelles mesures sanitaires pour prévenir la propagation de maladies. Let's now move on to some common symptoms and illnesses. First, we have allergy. Allergy. It's your body's reaction to a normally harmless substance such as pollen, molds, animals, certain food, and insect stings. C'est la réaction de votre corps à une substance normalement inoffensive comme le pollen, les moisissures, les animaux, certains aliments et des piqûres d'insectes. Allergy symptoms range from a mild rash or hives, itchiness, runny nose, watery or red eyes to life-threatening. Les symptômes d'allergie vont de légères éruptions cutanées ou urticaires, démangeaisons, nez qui coule, les yeux larmoyants ou rouges, à potentiellement mortels. Patients can also develop contact dermatitis, an allergic reaction to one or more of the ingredients in a medication. Les patients peuvent également développer une dermatite de contact, une réaction allergique à un ou plusieurs des ingrédients d'un médicament. Next, we have hay fever. Hay fever. Hay fever is a type of allergy. It's an allergy to plants and the pollen from flowers. C'est une allergie aux plantes et au pollen des fleurs. The symptoms are red eyes, des yeux rouges, runny nose, un nez qui coule, and sneezing, des éternuements. Next, we have a fever or temperature. It's a rise in body temperature, to feel hot. C'est une élévation de la température corporelle et de se sentir chaud. Next, we have cough. Even though it's written with a GH, it's pronounced cough with an F. It's your body's way of responding when something irritates your throat or airways. C'est la façon dont votre corps réagit lorsque quelque chose irrite votre gorge ou vos voies respiratoires. It's the action to force air out of your lungs, making a loud and uncomfortable noise. C'est l'action d'expulser l'air de vos poumons en faisant un bruit fort et inconfortable. Smoking makes me cough. Fumer me fait tousser. Smoking makes me cough. Next, we have dizziness. Dizziness. Dizziness is a term used to describe a range of sensations. Étourdissement est un terme utilisé pour décrire une gamme de sensations, such as feeling faint, sentiment de perdre connaissance, woozy, ou nébuleux, weak ou faible, or unsteady, instable. Dizziness that creates the false sense that you or your surroundings are spinning or moving is called vertigo. Les étourdissements qui créent la fausse impression que vous ou votre environnement tournez ou bougez sont appelés vertige. Vertigo. I felt dizzy after standing up too quickly when I was in the bath. Je me suis sentie étourdie après m'être levée trop rapidement quand j'étais dans le bain. Next, we have insomnia. Insomnia. It's not being able to sleep at night. Ne pas pouvoir dormir la nuit. Insomnia. We also have rash. It's uncomfortable, itchy, des manches, red spots on the skin, des taches rouges sur la peau. It's a skin condition. C'est une affection cutanée. She got a rash on her hand after touching a strange plant. Elle a eu une éruption cutanée sur la main après avoir touché une plante étrange. Next, we have run down or under the weather. Both of these mean a general feeling of sickness. Ces deux signifient un sentiment général de maladie. Run down usually comes from living an unhealthy lifestyle. L'épuisement provient généralement d'un mode de vie malsain. And under the weather means to not feel your usual healthy self. Ça signifie ne pas se sentir en bonne santé comme d'habitude. So, un patient pourrait venir vous voir et vous dire, Doctor, I'm feeling under the weather. Qui veut dire, ils se sentent pas aussi bien que d'habitude. We have sunburn. It's red and painful skin that comes from being under the sun too long. C'est une peau rouge et douloureuse due à une exposition trop longue au soleil. Finally, we have abscess. An abscess is the body's way of trying to heal from an infection. Abscesses form after bacteria, fungi, or other germs enter the body, usually through an open wound like a cut, and cause an infection. An abscess might appear on the skin, under the skin, in a tooth, or even deep inside the body. And symptoms are pain or swelling. Now let's look at some of the ways a patient might express how he's feeling or his symptoms and what it means. So look at these two forms we can use to talk about our health problems. We have, I have been coughing a lot these days, or recently, or for the last few days, or since yesterday. J'ai beaucoup toussé ces jours-ci, ou récemment, ou depuis quelques jours, ou depuis hier. This is called the present perfect continuous. The present perfect continuous. We have, I have a cough. It's the present simple. J'ai une toux. So both of these are used to describe our health problems. Les deux sont utilisés pour décrire nos problèmes de santé. But the present perfect continuous is used to show that something started in the past and is still happening now. The present perfect continuous est utilisé pour montrer que quelque chose a commencé dans le passé et se produit encore maintenant. We say I have been plus an ing verb. So like a verb that ends with ing. Other examples of this form include I have been sneezing. I have been sneezing. So, ça veut dire j'ai éternué. J'ai éternué, mais j'éternue depuis un moment, depuis quelques jours. My head has been hurting. My head has been hurting. It means that my head hurts for a while. So, ma tête me fait mal depuis un moment. I have been having headaches. J'ai des maux de tête. I have been feeling tired. Je me sens fatiguée. I have been feeling tired. Ça veut dire que je me sens fatiguée depuis un moment. I haven't been sleeping well. I haven't been sleeping well. Je ne dors pas bien depuis quelques jours. The present simple is used to focus on a situation at the present. The present simple est utilisé pour se concentrer sur une situation actuelle. It's more common to use the present simple than the present continuous when we see a doctor. Il est plus courant d'utiliser le présent simple que le présent continu quand on voit un médecin. So we say my head hurts, and it's more common than saying my head is hurting. So the present simple est plus utilisé que the present continuous. We can also use I have plus noun. Noun, c'est un nom. So I have plus un nom. Like examples, I have a bad back. I have a bad back. I have a sore throat. I have a sore throat. I have a fever. I have a fever. We can also say I feel plus an adjective, like I feel dizzy. I feel under the weather. I feel run down. We can also say something ache or sore something. These forms are usually used to talk about the general problem. So on utilise ces formes pour des problèmes plus généraux. Like a headache, a backache, problème de dos, ou une douleur au dos. Stomachache, douleur à l'estomac. Or we can use sore plus, like sore throat, or sore eyes, or sore feet. Let's now move on to some questions and answers a doctor might want to ask a patient. Try to repeat after me. What's the matter? What's the matter? Quel est le problème? Where's the pain? Where's the pain? Où est la douleur? What do you complain of? What do you complain of? De quoi vous plaignez-vous? Have you taken your temperature? Have you taken your temperature? Avez-vous pris votre température? For how long have you been feeling ill? For how long have you been feeling ill? Depuis combien de temps vous sentez-vous malade? Have you got any other symptoms? Have you got any other symptoms? Avez-vous d'autres symptômes? Has the pain been getting better or worse? Has the pain been getting better or worse? La douleur s'est-elle améliorée ou aggravée? Do you have a family history of, for example, diabetes? Do you have a family history of diabetes? Avez-vous des antécédents familiaux de diabète? Do you take any medicine or supplements? Do you take any medicine or supplements? Prenez-vous des médicaments ou des suppléments? On the other hand, a patient might express his symptoms by saying, I have got a high temperature. I have got a high temperature. J'ai une température élevée. I feel really rough. I'm shattered. I'm exhausted. Tous ces synonymes veulent dire je suis épuisé. I feel really rough. I'm shattered. I'm exhausted. Could you check my blood pressure? I've got high blood pressure. Pourriez-vous vérifier ma tension artérielle? J'ai de l'hypertension. High blood pressure et dites hypertension. There's a sharp pain here. I've a pain in my limbs. There's a sharp pain here. I've a pain in my limbs. Il y a une douleur aiguë ici. J'ai mal aux membres. My ears are buzzing. I've got an upset stomach. My ears are buzzing. Mes oreilles bourdonnent. My ears are buzzing. I've got an upset stomach. J'ai mal au ventre. I've sprained my wrist or ankle. I've sprained my ankle. Je me suis foulé le poignet ou la cheville. I've sprained my wrist. My hand or foot is badly swollen. Ma main ou mon pied est très enflé. My foot is badly swollen. I think I've pulled a muscle in my leg or arm. I think I've pulled a muscle in my arm. Je pense que j'ai déchiré un muscle dans mon bras. How often should I take this medicine? À quelle fréquence dois-je prendre ce médicament? How often should I take this medicine? Passons maintenant à la dernière partie de ce cours, qui consiste à quelques conversations entre docteur et patient, et essayer de suivre, d'écouter et de comprendre la conversation pour à la fin répondre à quelques questions. Hi Jessica, how are you feeling today? A bit better. That's good to hear. Are you still feeling nauseous? No, I haven't felt sick to my stomach since you switched my medication. Great. So your test result came in this morning. It's about time. Is it good news or bad? I guess it's a bit of both. Which do you want first? Let's get the bad news over with. Okay. It looks like you're going to need surgery to remove the tumor from your leg. After the operation, you're going to have to stay off your feet for at least 3 weeks. This means no soccer. I was afraid you're going to say that. Now for the good news, the biopsy shows that the tumor is benign, which means it's not cancerous. We're going to take it out anyway, just to be on the safe side. Whoa, that's a load off my mind. Thanks, doctor. Don't get too excited. We still need to get to the bottom of all this weight loss. I've probably just been worried about this stupid lump. These things are often stress-related, but we're still going to do a few blood tests, just to rule a few things out. Things like what? Cancer? Actually, I'm thinking more along the lines of a food allergy. Maintenant pour la deuxième conversation. Hello, what seems to be the problem? I have been having chest pain. How did the pain begin? What were you doing? I was resting and suddenly felt a stinging sensation around my chest region. Did you work out before? Almost half of the ischemic conditions occur after physical activity, emotional stress, or after consumption of alcoholic beverages. No, doctor, I did not work out or consume any alcoholic beverage. Have you previously ever had the same sort of pain? No, I have not. Can you please describe the pain and how long has it been bothering you? My chest feels constricted, as if I'm drowning. It has been approximately 30 minutes since I felt the pain. Sometimes It is a stabbing pain. Other times it subsides and begins anew. Tell me exactly where it hurts. It's on my sternum. Then it expands on both sides of my chest, mostly on the left side. Have you used any medication? Nitroglycerin, but I don't think it had any effect. Do you have any other problems? You appear very pale to me right now. I have a hard time catching my breath sometimes. Feels like I'm choking. I will prescribe you some medicines for a temporary relief, but I recommend you to get an ECG done and visit me immediately. Thank you, doctor. I will soon visit you with my ECG report.